Hello, good evening, all of you. Myself, Mohini Sirsar Golve. Today's seminar topic is the CHO Maharashtra Solve Answer Paper 2023. The CHO exam conducted by the NHM, and in this examination, 50 questions asked from their side in set A, set B, set C, and set D. So, on this examination conducted on the 22 January 23, and we guys are discuss this question paper on the platform that is the Motin Nursing Education. This is the instructed media. So we will see the one by one questions here. The question number first is that the what is the commonest cause of postpartum hemorrhage? First, guys, you should be read carefully all the questions because if you read carefully, that time you got the correct answer. And in that questions, firstly, you know about the meaning of questions. So what is the postpartum hemorrhage? Uh, Postpartum hemorrhage is a condition in which the bleeding start after the birth. These are the causes are here. They realize atonicity of uterus, subinhalation, precipitate of liver, puerperal sepsis. These are the causes, but they ask the commonest cause of postpartum hemorrhage. And in that commonest cause of hemorrhage, postpartum hemorrhage is the atonicity of uterus. And what is the atonicity of uterus? Atonicity of uterus is a condition in there occurs when your uterus doesn't contract properly after the childbirth. That time postpartum hemorrhage happens. This is the commonest cause of. Okay, we see the second number questions. That is the daily requirement of folic acid during pregnancy. Why the folic acid requirement necessary to the pregnant woman? Because if any deficiency of folic acid, that time a disorder is formed, that is the neural tube defect. That's why the requirement necessity. And again, that the questions they according to their options 400 mg, 800 mg, 1000, 2000 mg. So answer is the 400 mg per day. Daily requirement of folic acid during pregnancy is the 400 mg per day. Okay. Next questions. In epidemiological triad, the three basic factors are agent, host, and dash, dash, dash. Firstly, epidemiological triad. Triad that means in a triangle-like structure, they having one base of the agent, one base of the host, and third base of the administration, bacteria, immunity, or environment. The answer is the environment. Because any kind of infection spread the according to the epidemiological list triad. So you guys fix in your mind. These are the epidemiological triad: agent, host, and environment. Okay. Next questions. All are features of irritable bowel syndrome except. If you miss the word except, then go and correct in other options. And if you after the examination, if you again read, that time you lost your question's answer. So if you all the questions read carefully, and this must essential. So all are features of irritable bowel syndrome except. So firstly see all features of all are the features of irritable bowel syndrome. First is the pain in abdomen, yes. Diarrhea, yes. Constipation, yes. But vomiting is not related to the or not features of the irritable bowel syndrome. So except answer is that the vomiting. Okay. Next question we'll see. The wound where there is no break in the skin and externally characterized by swelling, discoloration, and pain is called as. Again, we read questions. The wound where there is no break in the skin. That means wound is closed. Second, externally characterized by swelling, discoloration, and pain is called as. So we'll read the options. Continued or closed wound, lacerated wound, abraded wound, or incised wound. Continued or closed wound, that means no any hair break. Lacerated, also they having break. Abraded, also having they have skin on the skin breakage. Or incised, also they having the break. So answer is that the continued or closed wound. Okay. Next question. Dash dash refers to the physical effect on the human body of a dietary intake inadequate in quantity or quality. So in that refers to the physical effect on the human body. In this situation, malnutrition, genetics, physiology, pathology are involved. But after part, we read of a dietary intake inadequate in quantity, quality. That time answer is the malnutrition refers to the physical effect on the human body of a dietary intake inadequate in a quantity or quality. So answer is malnutrition. Okay. Second question. Kwashiorkor terms is used when there is deficiency of. What time Kwashiorkor happens? What kind of deficiency are here? Protein, iron, vitamin D, or none of these? Everyone know about this question. Protein deficiency that time form a kwashiorkor. So kwashiorkor terms is used when there is deficiency of protein. Okay. Next question. Deficiency of vitamin D in children leads to blindness. The cause of blindness in children, what kind of deficiency happens? Vitamin A, vitamin Y, vitamin C, vitamin Z. The answer is vitamin A. Deficiency of vitamin A in children leads to the blindness. Okay. Next question. An epidemic usually affects a large proportion of the population occurring over a wide geographical area is called as. Guys, the question is mostly the rounding or close in that situation. So you guys are read carefully again question. An epidemic usually affecting a large proportion to the population. The situation epidemic, but they affect in a large proportion to population, and again that occurring over a wide geographical area. That means we read the options: sporadic, pandemic, episodic, or zoonotic. Sporadic in a epidemic conditions. Pandemic also in the wide geographical area. Episodic also in the small area. Zoonotic also the human. Those having the animals related infections spread to the human or in the animals to animals. But the correct answer is the pandemic. Got it? An epidemic usually affecting a large proportion of the population occurring over a wide geographical area is called as pandemic. Okay. Next question. Adequate vitamins that can be obtained through exposure to sunlight. Everyone know about this question's answer. Vitamin A, vitamin B, vitamin D, vitamin C. Answer is the adequate vitamin D can be obtained through exposure to sunlight. Okay. Answer is vitamin D. Next question. The scheme Maharashtra under NHM, where the Anganwadi and school children were inspected, treated, and referred whenever needed with the help of team is termed as. Guess what is answer? The scheme in Maharashtra under NHM, where the Anganwadi and school children were inspected, treated, referred whenever needed with the help of team is termed as. Read the options. राष्ट्रीय बाल स्वास्थ्य कार्यक्रम, चाइल्ड हेल्थ प्रोटेक्शन ग्रुप, चाइल्ड लेबर प्रिवेंशन टीम, सैनिटेशन एंड न्यूट्रिशन टीम. So what is the answer in that? Answer is the राष्ट्रीय बाल स्वास्थ्य कार्यक्रम, RBSK. Okay. By this RBSK scheme, the NHM, Anganwadi and school children were inspected, treated, and referred whenever needed with the help. Stream termed as, that's why we will nominate the Rashtriya Bal Swasthya Karyakram. Okay. Next question. Under National Immunization Schedule following were included except dash dash dash. Again here they ask the except. Words except is most important because they ask accepted. BCG also involving National Immunization Schedule, OPV also, hepatitis also, but smallpox not included in because they are the eradicated. That's why now in National Immunization Schedule, they can't be included. Okay, answer is the smallpox. Next, this is a system of storage, transport, and distribution of vaccines in the state of efficacy and potency at recommended temperature from the manufacturer to the actual recipient of the vaccines is termed as data system. This is a system of storage. Again, then transport and distribution of vaccines in the state of efficacy. So, guys, what are the options are here? Cold chain, procurement, legal vaccine, or public transport. The answer is the cold chain. In the cold chain, they form the storage, transport, distribution of vaccine, the state of efficacy, potency, recommended temperature from the manufacturer, and actual recipient to the vaccines is termed as cold chain system. Okay, got it? Next question. The period from birth to 28 days of life is called as diatus period. If the baby is born, we nominate them newborn till the 72 hours. Again, then we will be nominated as the early neonate, pre-neonate. But in the period of birth to 28 days of life, they ask question. What we nominate them? Neonatal, adolescent, early neonate, or peri-neonate? The answer is neonatal. Okay. Next question. As per Apgar scoring, 5 objective criteria were given except. Again, they ask here except. Afghan scoring 5 objectives criteria they followed us. So in this criteria, we will see the first number, respiration heart rate also involving, muscle tone also involving, reflex response also involving, skin color also involving. What is the expected questions? Answer is mid-arm circumference. So answer is mid-arm circumference. Okay, next question. 1 calorie is equal to dash dash joule. So guys, everyone know about the 1 gram of protein. How much provide calories? 4. 1 gram of fat provided 9. 1 gram of carbohydrate provided 4. So we should be count them 70. Multiply them. And again, the answer is that going to the 4.184. So 1 calorie is equal to the 4.184 joules. Got it? Next question. Vitamin C is rich in following fruits except. If you not read except word, then go and you should guys are take the amla. Okay, so read question carefully without any hurry. So vitamin C is rich in following fruit except lemon, also vitamin C involving, orange also having, amla also having, but onion can't be provided the rich source of vitamin C. So answer is onion. Next question. Normally 1 gram of oil gives dash dash calories. Same as I told you. 1 gram of oil. Oil is involving in a fat. So 1 gram of fat providing how much calorie? 9 calories. Got it? Okay. Next. Nutrients are obtained from food by the process of metabolism that takes place in the following step. Except. Again, they ask except. In the process of metabolism, what kind of involving? Digestion also involving. Absorption also involving. Assimilation also involving. But harmonization can't be involving. That's why except answer is the harmonizations. Got it? Next question. Following are the fat soluble vitamins except. Again, that also asks the except words. So, fat soluble vitamins are the A, D, E, K. The except answer is the C. Vitamin C is the except answer. Okay. Next question. In case of intraoperative care, when a client arrive in the operating room, 3 groups of personnel are involved in the care. In intraoperative care. Okay. We read the options. Anesthesia team, yes, also available. Surgical team, also available. Operating room nurse, also involving. The pathologist team can't be. Why? Because pathological team work we will be complete in a pre-operative stage. So they not working in a intraoperative care. The answer is the pathologist team. Got it? Next question. The general purpose of a venipuncture is dash dash dash. To collect a blood specimen, yes, we guys are puncture. Instill medication, we guys are puncture. Start IV infusion, yes, we will be do that. So answer are the all of these. Next question. Cause of peripheral cyanosis is. What are the causes related to the peripheral cyanosis? Arterial obstruction, venous obstruction, cold exposure, all of these. Why? Because the any obstruction related to the form the peripheral cyanosis, and again then if the patient providing the cold exposure, that time also happens the peripheral cyanosis. That's why these are the 3 causes. So answer is the all of these. Next question. The differential diagnosis of measles include following except. Again then they form the differential diagnosis related to the measles, and we will be choice except answer. So rubella also yes, Weisky diseases also having the for scarlet fever also, because in the 3 groups they having the some which is related include the diagnosis of measles related to that, but poliomyelitis are also different. So except answer is the poliomyelitis. Got it? Next question. Dash there is the science of food and its interaction with an organism to promote and maintain health. The science of food, that means going answer around the nutrition, genetics, embryology, biochemistry. Answer is the nutrition, because nutrition is the science of food and its interaction with an organism to promote and maintain health. Got it? Answer nutrition? Okay. Next. Fluorosis is a condition which caused due to the excess of dash content of drinking water. If you drink the fluoride, that happens, that time fluorosis happens, chloride, iron, copper. So if you drink contain fluoride, that time fluorosis condition is happens. That why fluorosis is a condition which caused due to the excess of fluoride content of a drinking water. Okay. Next question. Following are the primary symptom of Parkinson disease. They ask the primary symptom. Again, they ask except, because in a Parkinson disease, dopamine level is some of the time disturbances. So tremors in hand, and legs happening, stiffness of limb and trunk happening, slowness of movement and postural irritability also happening. But cataract is not related to the Parkinson disease. So answer is the cataract. Okay. Next question. The ratio of infant death registered a given year to the total number of live birth registered in the same year, usually expressed as a rate per 1000 live birth, is called as dash dash dash. Options are the birth rate, infant mortality rate, root death, neonatal mortality. If you guys remember one thing, the formula they will give according to that. So the formula is that the infant death registered in a given year divided by the total number of live birth in same registered year into 1000. That means the infant mortality rate. Got it? Okay. Next questions. The act passed in 2000 and amended done in year the 2006. Passed in 2000, amended in 2006, where there is law relating to juvenile in conflict with laws and children in need the care and protection is termed as Juvenile Justice Act, Child Marriage Act, Child Labor Act, Child Adoption, Child. So answer is Juvenile Justice Act, because Juvenile Justice Act they passed in 2000 and amended in 2006 for the juvenile in conflict with the laws, children and need to the care and protection. Okay, that's why the answer is the Juvenile Justice Act. Okay. Question number 30. The baby-friendly hospital initiative was launched in India to focus mainly on the practice and policy to adopt adaptive. Because in Indian culture, baby-friendly hospital initiative was needed to the purpose of breastfeeding, contraception, immunization, obstetric emergency. The answer is breastfeeding. Okay, got it? Next question. Omitting in neonates may occur due to the following non-organic causes, except in a omitting neonates occur due to the non-organic causes. And they ask except, so we will be see the organic causes searching. Okay. So irritation of the stomach due to the solid amniotic fluid and blood. Yes, non-organic causes. Aerophagy, that means the should be engulf here. That time they happen due to the omitting. Yes, happen sometime. Faulty feeding techniques. Yes, also omitting happen. But Hirschsprung diseases are also the different. That's why they are the except causes. Got it? Okay. Next question. Pathophysiology of birth asphyxia is related with the following condition except pathophysiology of birth asphyxia. So in the pathophysiology of asphyxia, the happening arterial oxygen tension also happening, accumulation of carbon dioxide also happening, fall in blood pH also. But congenital hydrocele, they can't be involved in that. Because congenital hydrocele is the congenital deformity and this not a relation related to the birth asphyxia. So this part can't be involving in a pathophysiology of birth asphyxia. Okay. So answer is the congenital hydrocele. Okay. Next question. Out of following diseases, which disease is eradicated globally? Again that, out of following diseases, which disease is eradicated globally? So here is the swine flu, polio, smallpox, measles. Some of the students, they're having the confusion in between the polio and smallpox. But the guys, polio is not eradicated complete because they eradicated only ongoing process. But globally eradicate the disorder or diseases is the smallpox, because in national immunization schedule, we guys can't be involving the smallpox vaccines. The same question they will ask in same questions. Okay, that was the answer is the smallpox is a globally eradicated disorder. Okay, and in that question, if you in our cover information in India, the smallpox eradicated April 1977 and by the nationally 8 May 1980. Got it? The smallpox disorder. Second question. PQLI. That means physical quality of life index include following indicator. Except, again they ask except. So we firstly search physical quality of life index indicator. Infant immortality, yes also. Life expectancy at age 1 also. Literacy also. But per capita GNP is the not indicator of physical quality of life index. So answer is the per capita GNP. Okay. Next question. Incidence rate is calculated using. What term will we use for the incidence rate calculations? Because some of the time we guys are needed to the census. So that time in daily census, we will be see the word using the incidence rate. So what is the incidence rate? Today's incidence rate, monthly, yearly. So in that case, we will be searching the ways they are here. We will be see the options. Number of new cases, number of old cases, both A and B, neither A or nor B. So answer is the number of new cases. Got it? Next question. Nalgonda technique is used for everyone. If you guys are know about the purification of water process, so in that purification of water we're using the Nalgonda technique. So in this process we inhaling the chlorine with the mixture of some other part, component, and we form the Nalgonda technique. So we will call them in the what kind of chlorination of water, defluoridation of water, iodization of salt, or dechlorination of water. So answer in that the defluoridation of water. Got it? Okay. Bhopal gas strategy in India is an example of. Firstly, you guys know about the what is the Bhopal gas strategy, because in the Bhopal, the some gas leakaging are happening, and this situation is forming in an epidemic situation. So in this situation, some barriers are happening, some crashes are happening. So this is a single exposure epidemic situation. Okay, and in that they having the common source also the gas strategy. Yes. So continuous epidemic, no, it's happening in single time. Propagated, again they having the repeated, no. Seasonal, again the repetition. So answer, that's why the answer is the common source, but with the single exposure of epidemic. Got it? Okay. Next question. Vaccines that are sensitive to freezing and should be protected from sub-zero temperature are, except, again they ask except. So we here see the heat sensitive. Okay, except they ask that means we will be search the heat sensitivity on what vaccines are heat sensitive related to that. Cholera, hepatitis B, and tetanus, they all are the sensitive to freezing. Okay, but OPV is the that some of the time oral polio viruses is sensitive to heat. That's why this is the acceptance. Okay, next question. Tuberculosis is a specific infection disease which is caused by. They ask the causative organism. M. lepri, no, is leprosy related to that? Mycobacterium tuberculosis, yes, obviously. E. coli also different. Shigella is also different. So answer is the Mycobacterium tuberculosis is caused by the tuberculosis. Okay. Next question. Dengue viruses are transmitted by infected. How do infection spread by the dengue viruses? The air, mosquito, water, or droplet? So answer is the mosquito. Is it Aedes? This one the viruses that we infected by the dengue. Okay. Next question. Live attenuated vaccine. Here they provided us options: polio, diphtheria, tetanus, anthrax. So in a polio, but they ask OPV, oral polio vaccines. Diphtheria, tetanus, anthrax, these are the not live attenuated vaccines, but OPV, oral polio vaccine, is in involving live attenuated vaccines. So answer is the OPV. But here is option IPV. That time not I've been going that. So answer is the OPV, polio. Okay. Next question. ICD stand for. Because ICD is International Classification of Diseases, and 10 stand for the revision. So they provided us here number of options are here: International Classification of Drug 10th revision, International Classification of Disability 10th revision, International Classification of Diseases 10th revision, International Classification of Disaster 10th revision. So answer is the International Classification of Diseases, because ICD stand for the classification of diseases, and according to that we will be classify some of the diseases or deformity. So that's why ICD stand for the International Classification of Diseases 10th revision. Next question. National Vector-Borne Disease Control Program does not include. National Vector-Borne Disease Control Program does not include. They include malaria, filaria, kala azars, but not include measles. That's why answer is the measles. Got it? Full form of ASHA. This question is number of time asked in different ways. Some of the time they asked their qualification, and qualification 8 pass. The person is also lives in their home where they stay, where this place working in ASHA. Also, they having for the single ASHA worker 1,000 population, and they providing their care in a community area. And there is some in a single question paper they ask the color of apron. So a color of apron is the blue. So guys, got it the enough information related to the ASHA. So we will hear the full form of ASHA. Associated social health activities, accredited social health activities, advanced social health activities, assistant social health activity. So answer is the accredited social health activity. That means the ASHA. Got it? Next question. Letharism, letharism due to consumption of. What kind of consumption you form the letharism? So we will be see here options: red gram dal, groundnuts, kesari dal or lag dal, or Bengal gram dal. But Lathrism is the consumption of Kesari dal or lag dal. That time from the Lathrism. Got it answer? Kesari dal or lag dal. Next, NPCDS stand for. This question is number of time asked in a different questions paper. So we will see the NPD stand for National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases, and dash dash dash. Here is N is for the national, P is program for prevention, C is control, again D is for the control of cancer, and again D is for the diabetes, again C stand for the cardiovascular diseases, and the balance is the yes. So in this yes, we will see as the option shock, stroke, and sun. So in that, the S stand for the stroke. Got it answer? So answer is the stroke. National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases, and Stroke. Got it? Next question. Normal systolic blood pressure for adults ages 18 years and older is dash dash mm of H. 18 years and older. Normal systolic blood pressure. So in this case, less than 120, less than 110, less than 100, less than 130. So answer is that the less than 120. In they will ask again then about the adult, about that the adult, that the answer going into less than 130 and minimum to 124 mm of Hg. So here the answer is the less than 120 mm of Hg. Got it? Next question. The single most important risk factor for oral cancer is dash dash dash. Most important risk factor for oral cancer. So in this situation, they ask means tobacco chewing, alcohol consumption, chronic trauma for oral mucosa, sunburn. So what is the most important risk factor? Also tobacco chewing, they form the oral cancer. Okay, got it? Next question. Normally during which stage of labor the placenta is delivered? You guys know in a delivery 4 stages are happening. So first stage that means the cervical stage, second stage that having the birth stage, third is the placental, and fourth is a recovery stage. So if first is not involving, then they ask the placenta. So answer is the stage number 3, that is the placental stage. So normally during which the stage of labor the placenta is delivered, the stage known as the stage 3. Got it? Next question. What is the reason for the golden color of amniotic fluid? Because in during pregnancy, the amniotic fluid color, they some of them seen their deformity or related the disorders. What kind of deformity, what kind of different actor they're happening. So in that they're providing options: RH incompatibility, fetal distress, post maturity, intermittent death. So in this situation, RH incompatibility, if the child or if the mother's amniotic fluid, the RH compatibility happening. So such situation time amniotic fluid color is the golden color. So answer is the RH incompatibility. So guys, we will be cover all 50 questions from our side. If you guys like this video, that time you go like them, comment, share, and subscribe also for the next video. And after that, if you we guys are interested committed with us, that time you should be we providing Motin nursing education. This one the instructed media, they form in a platform also available, YouTube channel Motin nursing education. Also you guys follow our Facebook, that means Motin nursing education, and we providing our the website motin.nursingeducation22.in. Our all I thankful to all of you from us side, our Moti Nursing Education team. If you guys like, then go please comment, share, and subscribe also. If anyone having any queries related to that, that time you guys comment your those whatever your comment, the comment in our comment box. We will be responding you as early as possible. So guys are again and thank you all of you. So you guys give me your valuable time for me also. and hears. Thank you, all of you.